Hi, I'm James Rippey and this lecture is on transabdominal pelvic ultrasound, looking for early pregnancy, how to do it and what to look for. The way we do ultrasound generally is we get the patient ready, we find what we're looking for, we optimize our image, and then we let people know what we found. And early pregnancy ultrasound is no different. Getting the patient ready, they're usually lying flat. We tuck a towel into their underwear to stop all the jelly getting all over their clothing. The patient needs to be exposed for an abdominal ultrasound or a pelvic abdominal approach ultrasound to the top of their symphysis pubis. Ideally they've got a full bladder, and you'll see why in a second, and they need to know what we're going to do. We use the curvilinear abdominal probe, and you make sure your preset is right. If you've got a non-pregnant patient, use the gynae preset. If the patient is pregnant, you choose whether you want a first, second or third trimester preset. The next thing is to find the image. We tend again to use big bold movements and then little fine ones. Use a constant firm pressure, use the best acoustic windows you can, and that usually means a full bladder so you can see through the bladder to the uterus behind it, and you fan through the pelvis in longitudinal and then in transverse. To optimize the image, you alter your depth, frequency, focus and gain. And then to communicate, you make sure you fill in one of our pro forma reports, which we'll go through here. This, as you've seen before, is our pro forma report, patient details at the top. You say whether the scan was transvaginal or transabdominal. In our case, transabdominal. You say whether it was adequate or inadequate. Then you go on to say whether there's an intrauterine pregnancy. To say that there is a definite intrauterine pregnancy, as we said before, you need to see a gestational sac in the uterus, and that sac has to have a yolk sac in it, or a yolk sac and a fetal pole with or without a fetal heart. So if you see a yolk sac or a fetal pole in a gestational sac in the uterus, then it is an intrauterine pregnancy. If not, it's not. If you do see a sac, you need to measure its diameter, say whether you saw the yolk sac or not, say whether the fetal pole was seen or not. So that's whether the pregnancy was intrauterine. The next question is whether the pregnancy is viable, and for viability you have to see a heartbeat. And if you see a heartbeat, you confirm viability. If you can, you say what the fetal heart rate was. Then you look for free fluid. If you see free fluid, you say that it was there. You characterize the amount, just a little bit or a lot, and what it looked like, whether it was anechoic or just black, or there was echogenic with grey bits, which is more consistent with blood or clot or pus. So let's get on to how we do it. This is the female pelvis in longitudinal section. Here's the anterior abdominal wall and the symphysis pubis. Here's the uterus. Here's the vagina. Here's an empty bladder. And here's the rectum. This is bowel containing bowel gas. So this is an anteverted uterus, and what that means is the vagina goes in this way and the uterus is bent forwards. It's anteverted. You begin by doing a longitudinal examination of the uterus, and you pop your probe on in the longitudinal position. This is what you'd see. So we zoom in on that. So you should, hopefully, see the uterus, the vagina, the bladder. But, unfortunately, we know that behind bone, one of the enemies of ultrasound, you get shadow, and you can't see what's behind bone. So, with a probe like this, you see black there. So that cuts out your bladder and the vagina and a little bit of the uterus there. We also know that behind air, which is the other enemy of the ultrasound, and there's air in this bowel gas here, you won't see anything. So, with the probe like that, this is the image you get. You can see the anterior abdominal wall nicely, the symphysis pubis, but behind it, you really can't see anything at all. How do we fix that? Well, you put your probe on and you press harder. But not only do you press harder, you press and you peer into the pelvis. You look down into the pelvis. Here we're looking across, here we're looking down into the pelvis. So you push down and look in. Now what happens? So push down and look in. Here is what you should see, and this time the shadow made by the symphysis pubis is less prominent. If you're unlucky, there'll still be bowel gas in between the uterus and the anterior abdominal wall, and you won't see much at all. But generally, you manage to, by pushing like this, you move the air out of the way. You might get a little bit of fecal material with little air in it, but this is what you'd see. Yes, you'll see bowel gas here, and you won't get a great picture here, but you should see the anteverted uterus, the endometrium, a bit of vaginal stripe, and a bit of bladder. And here's that picture of the patient with an empty bladder. Here is the uterus, cervix down here, uterus, this is the endometrial stripe, here's the empty bladder, and this is the vagina. Here is bowel gas behind here, and we've actually just missed the symphysis pubis shadow there. So here it is again, here's that picture, and there is our equivalent image of the empty bladder. Uterus, endometrial stripe, cervix, vagina, bladder, bowel, bowel gas, and anterior abdominal wall. Okay, now it all makes sense. Now you might just think that that's just a one-off, but here's another case, the same thing. Empty bladder, the uterus sits anteverted, usually, cervix here, vagina here. This time you don't see the bladder at all, just the bladder wall, it's so empty. Anterior abdominal wall, bowel gas. Rectum behind the vagina here. And another case, same again. See, now we're getting a pattern with an empty bladder and an anteverted uterus. This is what it looks like. Here's another one. Vaginal stripe, this double vaginal stripe. There is the lumen of the vagina coming down. Here's the cervix. Here's the fundus of the uterus, bent forward, really anteverted, empty bladder, bowel material, bowel gas. And the anterior abdominal wall here is actually abutting the uterus. So that you push the gas out of the way by pushing in. This is air in the rectum here. Okay. But I said that our picture's better with a full bladder. So here the uterus is anteverted. As your bladder fills, it pushes the uterus back. And as we know, we can see very nicely through the bladder. The bladder acts as an acoustic window, and it makes the uterus more perpendicular to the ultrasound beam. So you again put your probe on longitudinally. Now, without pushing in, you'd expect to see something. Shadow from the symphysis pubis, bowel gas here, but you are able to see through the bladder, and you should be able to see this bit of the uterus. If you push in, you should see even better. Here we go. This is what we should be seeing if we push in with a patient with a full bladder. Bit of shadow here, full bladder, uterus, nice endometrial stripe, vaginal stripe, and some bowel shadow and bowel gas behind. And here it is. So there we have it. This is what we should see. And here we have it. Bladder, uterus, cervix, vaginal stripe, bowel gas behind. Okay, and just to show you that it's not a one-off. So we have here and here, uterus, cervix, vagina. Here, another patient, uterus, cervix, vagina, rectum, bowel gas, and bladder. This is the longitudinal approach. Here's the anterior abdominal wall and the skin up here, looking deep into the pelvis down here. There we have it. And again, another patient, this time the uterus here, vagina here, bladder here. Now, to confirm that that's a uterus, how do we make sure that that mass is a uterus? Well, the uterus attaches to the cervix, attaches to the vagina. If whatever mass you're looking at has an endometrium in the middle and is attached to the cervix and attached to the vagina, it's definitely the uterus. Here's another one. Bladder, uterus, vagina. Bladder, uterus, cervix, vagina, rectum behind. And another one. You see, this isn't rocket science, it's pattern recognition. And another one. And another one. And another one. It all looks the same. Vagina, uterus. The size of the uterus might vary, the size of the bladder might vary. So here we have the empty bladder, and then as it gets a bit fuller, it pushes the uterus back. And fuller still, fuller still, fuller still, fuller still, until you've got a uterus that's almost lying perpendicular to the direction of the ultrasound beam. Now the next important thing is to fan the probe from one side of the pelvis to the other. That's really important because often the uterus doesn't lie in the middle. You've got to explore the entire pelvis, and you've got to explore the entire uterus, explore the pelvis for free fluid, see if you can find the ovaries and see if you can find adnexal masses, although those steps are in more advanced ultrasound. So here you'd think it would be easy. You've got the female pelvis here, vagina, uterus, tubes and ovaries. Excuse me. But the problem is there's bone in the way, and often bladder, and there are blood vessels around. There's large bowel, small bowel, and sometimes that small bowel sits in front of the uterus. But not only that, to make things more difficult, sometimes the uterus sits one side or the other side. And those ovaries can move all around either. They can be anywhere. And as you can imagine, ultrasound then gets a bit tricky. I was going to set this to music, but I couldn't find it. It was just right. The other thing that's complicated is that the uterus isn't always anteverted. It can be axial, which means it's in the line of the vagina, or it can be retroverted, which means facing backwards. So here is the standard anteverted uterus. Here it's in a more axial position, but it can be in this position even with an empty bladder. And here is a retroverted uterus. Now that really makes life more difficult because you can imagine with all this bowel gas up here, you're never going to see that bladder, that uterus. Unless the rectum's quite full and you press really hard, your views aren't going to be great. And it's these patients that really need a transvaginal ultrasound where you put the probe in here and you can get a better picture that way. Having said that, here is a retroverted uterus. There's some fecal material in the rectum here, emptyish bladder, but you can see this uterus is facing backwards. It's a retroverted uterus. And another one. There's a trace of free fluid here, retroverted uterus. Another retroverted uterus with the endometrium here. Another one, vaginal stripe, cervix, retroverted uterus, and the bladder. So it's really important to get a longitudinal view of the pelvis, that we put the ultrasound probe on the abdomen and look at the pelvis in longitudinal, and then we fan it from one side to the other side, right through the pelvis, so we see right from the iliac vessels on one side, through ovaries, down to the uterus, through the ovaries, all the way to the iliac vessels on the other side. What do I mean by that? Well, here we go, we've got the ultrasound probe here, and we fan it through the pelvis from one side to the other. Keep going until you're sure you've found that uterus, found what's lying inside that uterus, and taken some pictures. And here is a video of exactly that, fanning through the uterus. We start on one side, here are the iliac vessels. We go back through the uterus with its fundus here, cervix here, vagina here, bladder here. We start on one side, go back through to the middle. Here it is in longitudinal. We fan right through that uterus, seeing if we can see a little pregnancy, and right to the other side. That's what I mean by fanning through the pelvis in longitudinal section. This is doing exactly the same thing, but this time with an empty bladder and an anteverted uterus. So here we are. We start on one side, you fan through vagina, uterus, right through to the other side, you see, and then back again. That way you can see if there's any pathology anywhere in the uterus. You're not just taking one picture. And then you do transverse views of the pelvis. So now, instead of having the probe longitudinally, you turn the probe this way, and you need to take some pictures of the uterus that way. And again, you fan through, right from the top of the pelvis, through the fundus of the uterus, down through the cervix, and then down through the vagina. And that way you've explored the pelvis from side to side and from top to bottom, and you can't miss anything, you think, although bowel gas tends to cause problems, and we do miss things. But at least you've got an orderly way of exploring the pelvis with ultrasound. So here we are doing our longitudinal image. This is what we see, and there is our picture. Now, if we turn our probe 90 degrees, what we'll be getting is a slice of image perpendicular to this image. And so what we should see is the uterus, which will be round in a transection here, with bowel gas behind it, and a bladder in front of the uterus, which will be more rectangular in shape. So here we are, our longitudinal view. We take a transverse through here, like this, and we should see ovary one side, although, as I said, the ovaries can be up and down and all over the place. Uterus in the middle, which will be a round slice of the uterus, and ovary on this side. Let's see. Longitudinal, transverse, uterus, ovary, ovary, bladder in front, bowel behind. Bladder, uterus with endometrium, and ovaries with bowel gas behind. Longitudinal, slice across, transverse. Now, here is the longitudinal with an empty bladder, and you can imagine if we take a longitudinal shot through that, we get a slightly different slice of the uterus. It'll still look round with endometrial slice here, but then you sort of go up underneath the uterus and then you go through the cervix. So you might see a round thing here, little bit of bright stuff here, and then slice the cervix here and then bowel gas behind. Let's see what exactly that image in transverse gives us. Here it is. The round uterus, a little bit of free fluid there, little black triangle of free fluid, round fundus of the uterus with the probe here and a slice of the cervix here. There it is. Wouldn't it be nice if ultrasound made things colour like that, but Photoshop does. Bowel gas behind. Okay, so again, transverse views of the pelvis, fan up and down. Those are the static shots. Let's do some fanning shots. And here it is. This is what you need to do. Fan right through. And at this point, you'll start reaching the fundus of the uterus. And then keep going down through the body of the uterus. You might have a look at those ovaries in a bit more detail with more advanced ultrasound. See if you can find a gestational sac or something inside the uterus that we're looking for by repeatedly fanning, and then fan all the way down through the cervix and down into the vagina. That way you explore the entire pelvis. And this is a video of exactly that. We start at the top, right here. We've got the round uterus. Here it is. The endometrium comes in. We fan down through the fundus, down, down, down through the cervix, here and into the vagina. Here's vaginal stripe. There's urethra. Here's bladder. We saw ureteric orifices there just for a second, and now we're fanning back up again through the cervix, back up to the uterus. Here we go through the uterus and out through the top of the fundus. Once more, down through the fundus, endometrium here, down, down. This is all bowel gas behind. Down we go through cervix, here, vagina. Those are ureteric orifices, and this is the bladder. Transverse scanning. I know now we've viewed that uterus in its entirety. We haven't missed anything, and we probably haven't missed anything huge in the uterus or in the pelvis as a whole. So when you look at the uterus and the pelvis, what should you look for? You start by looking at what's inside the uterus. At level 1 ultrasound, what's inside the uterus? Is there a gestational sac? And if there is a sac, you need to look at that and measure that in 2 planes. So you fan back and fro until you find your gestational sac. You think, oh, okay, excellent. Let's take a picture of that. You measure that across and up and down. Then, to measure it in the other axis, so you've taken a picture of it this way, and you've measured it vertically and its depth. Then you change your probe to 90 degrees, and you fan up and down, and you measure it in this plane, the transverse plane. Add all those measurements up, divide by 3, and you've got the mean sac diameter. So you have to look for and measure the gestational sac. Then you need to look for the yolk sac. Then you look for the fetal pole, and you try and find the fetal pole in the longest dimension and measure the crown rump length, the length from one end to the other. Then you look for a heartbeat in that fetal pole to determine whether it's viable or not. And you record the fetal heart with M mode or a little video clip. And we'll do this in our practical sessions. The last thing you need to look for with level 1 ultrasound is free fluid. And once again, our report takes us through these. Intrauterine pregnancy. Is there one? What's the mean sac diameter? Measuring those 3 dimensions and dividing by 3. Is there a yolk sac? Is there a fetal pole? Is it viable? What's the fetal heart rate? Is there free fluid? And if so, what's it like? So here is a picture. Let's concentrate on the gestational sac here. We can measure it here to here and here to here, and then take another image perpendicular to this to measure it from here to here in the longitudinal, in the transverse view. So we've looked at the gestational sac and measured it. Then we can look for the yolk sac. We don't need to measure that, but we've seen it's a yolk sac, which means it's definitely a pregnancy, and it's in the uterus, because this is the uterus. Then you find the crown rump length, and you measure from one end to the other. And the calculation programs of our ultrasound machines will automatically tell us what that gestation is. Or you can use the reference on our report pro forma to work out exactly what crown rump length that long, what gestation that will be. We then hold the probe very still and look for the flicker of a fetal heart. So in the uterus, gestational sac, yolk sac to confirm that it's a pregnancy, fetal pole with crown rump length, and fetal heart. So those are things to look for in the uterus. What about free fluid? Well, this is our anteverted uterus. You'll remember that well. When you start getting fluid, not surprisingly, it collects dependently. A little bit of fluid collects in the pouch of Douglas between the uterus and the rectum, just here. As you get more fluid, it gets more obvious, and fluid is black on ultrasound. But what's a bit tricky is that blood clot is grey. And when you get acute bleeding into any part of the body, you tend to get, just like if you put blood in a clotting tube, you get clot, which is grey, and then serum, which is black. And if you get acute bleeding in the pelvis, most of this will be black, but there will be bits of clot around the place. As you get yet more fluid, it does this, and you'll have this big black area around here, the uterus inside it, and sometimes the blood comes right down in front here as you get more and more, and the uterus floats free back here, and you have blood all around the uterus. Here's a small amount of free fluid just behind the uterus in that longitudinal view. So there we go, that's that equivalent there. Here's another one, a little bit of free fluid in the pouch of Douglas. Important not to confuse the bladder with free fluid. Here is a clot. This is behind in the pouch of Douglas. This is a blood clot with a little bit of the serum type fluid here, but clot. And this, you'll see other pictures in our course of far greater amounts of blood, which are much more likely to cause hemodynamic instability. It's really important that you understand that the female of reproductive age is allowed to have a trace, a little bit of free fluid in the pelvis, and a little bit of free fluid is like this. This is more than a trace of free fluid. This is a small amount of clot. So recording of our images, we should ideally take a transverse view through the fundus and a longitudinal view through the uterus, showing that it connects to the cervix and the vagina. If there is an area of interest, like a gestational sac, you should take pictures of that in 2 perpendicular planes, the longitudinal and the transverse. You're welcome to use clips and little video clips, but they use a lot of memory. You can use M mode to record fetal heart, and we'll show you how to do that on the course. And you fill in your early pregnancy report.